Today we are going to study the upper limb. This is the first lecture of our anatomy series. If you like our videos, please subscribe our channel. The upper limb is divided into the shoulder, arm, forearm, wrist, and hand. So let's start with the bones of shoulder girdle and arm. The shoulder girdle consists of the clavicle and the scapula, which articulate with one another at the acromioclavicular joint. Now let's discuss the first bone, which is called the clavicle. The clavicle is a long, slender bone that lies horizontally across the root of the neck, just beneath the skin. It articulates with the sternum and first costal cartilage medially, and with the acromion process of the scapula laterally. The clavicle acts as a strut that holds the arm away from the trunk. It also transmits forces from the upper limb to the axial skeleton and provides attachment for muscles. The medial two-thirds of the clavicle is convex forward, and its lateral third is concave forward. So here you can see clearly sternal end articulate with manubrium sterni to form the sternoclavicular joint medially. On the other hand, the acromial end of clavicle articulate with acromion process of scapula to form the acromioclavicular joint laterally. So now let's move on to the shaft of clavicle. The shaft of clavicle is divided into lateral 1/3 and medial 2/3. Lateral 1/3 has two surfaces and two borders. Medial 2/3 has only four surfaces, which provides attachment for different muscles. The superior surface of the lateral 1/3 of the shaft of the clavicle is smooth and subcutaneous, while the inferior surface is rough. The inferior surface contains conoid tubercle for conoid ligament and trapezoid line for trapezoid ligament, and these two are covered by the coracoclavicular ligament, which arise from the coracoid process of scapula and cover the AC joint. The posterior border of lateral 1/3 gives attachment to trapezius muscle, while its anterior border give attachment to the deltoid muscle. Then we have four surfaces of medial 2/3 of the shaft of clavicle. The anterior surface gives attachment to pec major muscle. The posterior surface gives attachment to sternohyoid muscle. The superior surface is smooth and gives attachment to the sternocleidomastoid muscle, while the inferior surface contains costal tuberosity for first costal cartilage ligament, the subclavian groove for subclavius muscle, and nutrient foramen for nutrient artery. So these are the muscles which attach on the clavicle. This diagram that I add will clear your concept. Now let's discuss the fractures of the clavicle, because it's a most common bone to fracture. The clavicle is a strut that holds the arm laterally so that it can move freely on the trunk. Unfortunately, because of its position, it is exposed to trauma and transmits forces from the upper limb to the trunk. It is the most commonly fractured bone in the body. The fracture usually occurs as a result of a fall on the shoulder or outstretched hand. The force is transmitted along the clavicle, which breaks at its weakest point, the junction of the middle and outer thirds. After the fracture, the lateral fragment is depressed by the weight of the arm, and it is pulled medially and forward by the strong adductor muscles of the shoulder joint, especially the pectoralis major. The medial end is tilted upward by the sternocleidomastoid muscle. The close relationship of the supraclavicular nerves to the clavicle may result in their involvement in callus formation after fracture of the bone. This may be the cause of persistent pain over the side of the neck.